Hello everyone, this is Dr. Jawad. Welcome to my channel. If you haven't subscribed yet, please hit the subscribe button down below and the bell button to get up-to-date notifications. I do my best to put out videos weekly. I get my material usually with questions from my patients and also to the subscribers. So if you have a question that you want me to cover, please leave a comment down below. I'll be more than happy to cover material that you, the viewer, is interested in. My channel only grows when I have a lot of feedback from my viewers, and I appreciate all my comments. So, hope you enjoyed the video. Thanks for watching. Hello everyone, this is Dr. Jawad. In this short video, I'm going to talk about a symptom, high blood pressure, otherwise known as hypertension. Now, what is hypertension? Hypertension is when you take the blood pressure reading, it is consistently 140/90 millimeters of mercury. Now, to properly take your blood pressure, you want to take it 3 times a day, morning, noon, and night, and you want to average those numbers, okay? Because your blood pressure is going to fluctuate throughout the day anyway. So you always want to do it 3 times a day and take the average. Now, there's two primary types of hypertension. One, primary hypertension or essential hypertension, or idiopathic, which means they don't really know. That's 90% of the cases. So again, it has to be persistently elevated with no particular cause. We just don't know. However, about 10% of the cases, it's secondary hypertension, meaning that it's due to something else, particularly the kidneys. Now, the kidneys, through the kidney function, that actually regulates blood pressure. So if you have an underlying cause like a kidney obstruction, maybe in the renal artery, okay, or the collecting ducts, or one of the tubules, the nephron, that will elevate blood pressure. Or you have hypersecretion of aldosterone. Aldosterone is a hormone that's secreted by the adrenal glands in relation to low blood volume. Now, the function of aldosterone is to tell the kidneys to retain sodium. So when you retain sodium, water follows, so you increase the blood volume, decrease the blood pressure. Hypersecretion of epinephrine and norepinephrine. These are your fight or flight response. These are fight, flight, or free hormones that, again, when times of stress, the epinephrine and norepinephrine is going to elevate the heart rate, which will cause vasoconstriction, and you want to increase blood pressure. So if you're making too much epinephrine and norepinephrine, that could be a cause of hypertension. Or the tumor of the adrenal glands. Now, the adrenal glands are about the size of a quarter, and they sit on top of the kidneys. And the adrenal glands, they do regulate blood pressure. Okay, so again, these are the secondary causes. Now, when you have either primary or secondary hypertension, typically the treatment protocol is medication, avoid salt, and also they put you on a diuretic. Because what you want to do, wherever salt goes, water follows. So if you have increased blood pressure, they want to thin out the blood volume because they want to shunt out the sodium. But also too, there's another cause called metabolic syndrome. Now, metabolic syndrome, this is high blood pressure, high cholesterol, high sugar, and increased belly fat due to hypersecretion of cortisol. And also too, insulin resistance. So these 5 symptoms they put together, which they call metabolic syndrome. But here's a caveat. So you have insulin resistance. So the side effect of insulin resistance, which basically means your body is producing too much insulin, is high blood pressure. So you can see how this is kind of it's a circle. But also too, high blood pressure, increased cholesterol, increased sugar, and increased body fat is all the side effect, or symptom, of insulin resistance. So which one is doing what? So then what happens when you have insulin resistance? Insulin resistance is basically you're producing too much insulin due to an underlying factor. So what happens when your body is producing too much insulin, it causes stiffness of the arteries, sodium retention, your body's holding water. So if your body's holding water with insulin resistance, it's going to not absorb the potassium. So you're going to have low potassium. Now, potassium is one of those minerals that will naturally lower blood pressure. We need 1,500 milligrams of sodium per day, but we need 4,700 milligrams of potassium. So if you have too much sodium and too little potassium, you're going to increase your blood pressure. If you have too much insulin, same thing. So what's going to happen if you have too much insulin, it's going to cause vasoconstriction. So you can see how there's an underlying factor here. So what happens when you have too much insulin, okay, it blocks the potassium from being absorbed, which will in turn, if you block the potassium, like I mentioned earlier, you're going to increase your sodium. If you increase your sodium, you're going to increase the blood volume, and you're going to increase your blood pressure. You see how this is a vicious cycle. So what comes first? Is high blood pressure a symptom, or is it actual diagnosis? Is it primary, or is it secondary? Now again, whatever they do is that they want to put you on medication, avoid salt, and diuretics. So what you want to do, what you're looking for, if you want to treat high blood pressure naturally, you want to go to the underlying cause, and the underlying cause is too much insulin. So you want to lower the sugar, you want to lower the carbohydrates, okay, and you want to increase your vegetables, because increase the vegetables, the minerals, particularly potassium. Now avocados are loaded with potassium. The average avocado probably, I think, has about 2,000 milligrams of potassium per day. I'm sorry, per avocado. And we only need 4,700 milligrams, so have 2 avocados. Not only is it going to help lower your blood pressure, but it's also good for you. So again, your goal to help regulate blood pressure naturally is to lower the insulin, lower the sugar, and increase your vegetables. Hope you enjoyed the video. Please hit the like button down below. Please share with a friend, and I'll see you in the next one. Be good. Hello everyone, this is Dr. Jawad. Hey, over the last couple of years, my YouTube channel has grown tremendously, and I can only appreciate it, the viewers who subscribe. Now, if you're watching this on YouTube, please hit the subscribe button to get the first up-to-date videos, or you could always Google my name, Dr. Jinaan Jawad, and you could go to my JDoc Real Minute page. Again, if you hit the subscribe button, you'll get the most up-to-date videos, and thanks to everybody who's watching. I greatly appreciate it. Thank you.